there. These beautiful horses, it must be lunchtime. I'm sure they'll, if they're interested, they'll come over. I wanted to talk about equine assisted therapy and what that is. You have a clinician who's also familiar with horse behavior. They work with people around the horses in their sessions, and this really helps the individual. They watch the horses, and those observations can help give them information about themselves. It's great for those people who a variety of issues. For example, those who might have experienced a death and loss. Psychologists say that death is a natural process, and so is grieving. But it can be difficult for people at times. Also, maybe there's a relationship that ends in divorce. That can be difficult. Or perhaps relationships that have trust issues, affairs. Those feelings are sometimes hard to deal with on your own. And what happens is people become more withdrawn. Other situations might have families with a deaf child, or parents who are deaf with a hearing child. There are issues of communication. That's a good example. Or someone who's lost their hearing later in life. It can be a very difficult adjustment. Maybe there's depression. Or a person that has a deaf-blind individual who's trying to deal with trust and using the cane. There's a variety of situations you can think of that deal with your emotions. Equine assisted therapy helps with the healing process. I'm not saying that, you come and one day you're cured. It takes time. When you come to sessions with a clinician, you discover different things about yourself. Horses can facilitate that healing process. Counseling sessions in an office are good, yes, but sometimes people hold back. They're not sure why. Here, in equine assisted therapy, there's a chance to break through some of those resistances. And if you want to know more, I suggest that you contact PBJ Connections Polly is the executive director. She can provide you with more information about the costs and the programs. It's amazing. They're still eating. That's okay.